Hi there, my name is Dave.
Hey, I'm Bobby.
Bobby, nice to meet you. I'm a student nurse at the University of Manitoba, and I brought you here to my office today to talk about diabetic wounds, diabetic wound healing, and how to dress a wound. Now, is this a good time now to start this? I want to give you a little demonstration.
Yeah,
Now's a good time?
Yeah, for sure.
Okay, excellent. So I want to assess first off, what do you know about diabetic wounds and injuries like cuts and stuff with diabetes?
Well, in terms of dressing a wound, I've done it before, but when it comes to dressing a diabetic wound, I wouldn't know anything about it.
Okay. It's actually very similar to the actual dressing of it. There's complications though when you do have diabetes. So the main complication, I'm going to use the example of a diabetic foot wound, like a pressure ulcer, because that's the most common actual diabetic wound. And a pressure ulcer with diabetes is a leading cause of almost half the amputations out there are caused by diabetic foot wounds. So we'll use that as our example.
I've heard of that before.
Yeah. Okay. So high blood sugar does a lot of things to your body. First off, it causes your extremities, especially in your feet, to lose the ability to feel sensation, to feel pain. Okay. So you could be walking around all day with a little stone in your shoe. You don't even know that it's in there, and it's digging in there. Okay. And it's causing a wound. Now, second, we have high blood sugar. What does bacteria love to eat? Sugar. Okay. So you get a wound, it's already in there, you can't feel it. You get the high blood sugar, bacteria is in there.
Does it infect fast?
It infects very fast. Okay. It can. Yeah. So, and then there's two other things. Also with diabetes, with high blood sugar, you get less blood flow to your extremities. So you have a wound, you have bacteria, and you have less blood flow, less oxygenation, and then your wound doesn't heal.
Okay, makes sense.
Okay. And third thing is you lose the ability to sweat actually a bit, so it gets dried out, and often in the feet it cracks. So a little tiny wound, or just even a crack from dryness, can turn into an amputation, like in a week of a toe or something. So it's very, very important. So, if you could tell me, in a nutshell, what are the complications of diabetes and having a wound?
Okay, well, I would have to say that you lose feeling, which means you could get wounded easily.
Yeah.
Once you're wounded, it would like to eat the sugar in your high blood sugar, which would cause an infection to grow fast.
Yep.
And then it dries, which would cause it to crack and stay open longer.
Yeah.
And what would be the last one?
Decreased. Did you say decreased oxygenation?
Decreased
blood. Yeah. So you get a wound easy, don't know it's there.
Doesn't heal.
It doesn't heal. Become a nightmare really fast.
It infects fast.
So first, I want to show you that's assessment of a diabetic foot wound. So the first thing, we're going to talk about foot wounds because that's kind of our exemplar. What you need to do is you need to check your feet every day before you go to bed. You need to wash your feet every day before you go to bed.
Okay.
You've got to prevent any sort of minor irritation. Okay.
It's preventative more than it is.
Absolutely, absolutely. So if you notice any sort of redness, you can feel warmth. There's different stages of pressure ulcers as well. So just like general redness, even with diabetes, we're worried about that. We want to keep that clean. We want to stay off that.
I feel like deep tissue, so like a bruise that could be
absolutely. So we have a step one. That's like your first dermis layer. Okay, and that can very, very quickly go into a stage 2. Which is down to your epidermis, that's your second layer. And then once it goes into stage 3, it's in your fat layer. And this is getting really serious.
Okay.
We're worried about systemic infection. We're worried about getting to a stage 4, which is all the way down to the bone. And if we get down
your nerves, through everything?
Through everything.
Right.
And if you get a bone infection, that's really, really, really serious. We're talking amputations and stuff like that. So that's our stages. So basically, we're looking for redness, swelling. If you notice that you have some sort of ulcer, you want to see if it's growing. You know, any signs of redness, any signs of infection, see a doctor right away. Yeah. So what's the rule of thumb when you're looking for your feet?
On every single evening, wash them, check them, and if there's something, get immediate medical attention.
Absolutely, absolutely. Okay, so now I'm going to quickly show you how to clean a diabetic foot wound. Okay, I'm going to show you first. So a couple rules when you're cleaning, like this is just, let's say you just notice that you have a little tiny nick, okay? We're gonna not say that we have a massive pressure ulcer. Pardon my feet.
No worries.
let's say you just have some dryness and some cracking around your foot.
Okay.
All right. So what you want to do, you want to avoid alcohol. You want to avoid hydrogen
Because of
peroxide.
the sugars in it?
It's just really rough on your skin, okay? So we want to have normal saline or just regular water, okay? So I'm not going to try, instead of getting us wet, I'm going to pretend that we have just a bit of normal saline.
Okay.
Normal saline is just water with a little bit of salt. It's the exact same concentration as your skin.
You can rinse it with your mouth.
Absolutely.
Okay.
So we can take a little syringe, all right? And we can find that little cut or whatever, and just like you can just rinse it out, just like that. Just kind of
So use the
irrigate it
pressure
out.
from the syringe to rinse
Yeah, and irrigate it out.
Okay.
You want to take one of these cotton swabs, dab it in your normal saline, and this is like physically just removing the dirt or any pieces. And if it's like a bigger circular wound, you want to start in the middle of the wound and work your way out.
Okay.
And you want to push down fairly hard. You're physically removing.
So even if it's a little discomfort, the cleaning is better.
You don't want to make it hurt.
Yeah.
Okay. And then we take just a regular gauze. Now you want to open this sterilely. So you open it like this. Okay. Ideally you could wear gloves, but you don't really have to too much. You want to get
If I'm at home kind of thing.
Yeah. You want to make sure that the part that's going to touch the wound
Is not.
is not touching anything else.
So don't like hold it in my mouth while I'm taking the tape
No.
out.
No. And it's okay that it's damp. You want actually a wound heals better when it's a little damp.
Okay.
And you just once again pardon the lint on my socks. And just like that. So I'm gonna get you to show me how to clean and dress the wound real fast. If you can.
I'm at home, I'm doing my nightly check.
Yeah.
Okay. I noticed some cracking in my foot. So what I would do is I would get my saline and a syringe. Both of them would be obviously sterile. And I'd be careful with that. What I would want to do is, of course, I would have a towel and stuff like that to avoid it. I would take saline water, which is a solution pretty much consistent.
You can also use tap water too.
Okay,
Tap water is okay.
doesn't have to be.
Just make sure it's not hot.
Okay, and then in the cracks, I would take the saline, get like some in there, and then what I would do is use the pressure from the needle to rinse it, and really get in there. Do a couple of those maybe. And then, to be thorough, I would take one of these. You betcha. I would dip it, and depending on the size of the wound, circular starts from the center, circular out. Don't want to cause pain, but I want to get it clean. And then I would open this in a sterile fashion.
Absolutely. One more thing, you can add antibiotic ointment is really good, like a polysporin or something. Is a really good option.
Not peroxide.
Not hydrogen peroxide.
alcohol.
Not alcohol. Very good. Okay.
And then if I had a glove or not, whatever. And then I would take that.
That's actually a good idea. Just like go like that, without touching it, and then you got your tape.
Send it over there. Pretend like I'm closer. And then I would set that up. And then, actually, because I have the wound, if this is new, I would still get medical attention tomorrow.
Absolutely.
You guys, this is going on.
Absolutely. Okay, great website, diabetes.ca. Check it out. It's got everything you need to know about diabetic foot care. And it's a great site just for a quick reference.
All right, I'll be careful and in touch.
Perfect. Thank you so much.
Thank you.
Okay, take care.